Good afternoon, everyone. Good afternoon, Felipe and Erik. It is a pleasure to be part of this panel, and I want to thank the FIS initiative. We are having a little bit of an audio problem with Mr. Bruno's audio. The booth apologizes. And we will talk today about caring for patients at home. How can we treat all players involved in this ecosystem? The interpretation booth apologizes. We cannot hear Mr. Bruno's audio. Well, good afternoon, and thank you, Bruno. Your audio was freezing a bit, but I guess we can understand a little bit. So good afternoon, everyone, and thank you very much for joining us. I want to thank the FIS initiative for the invitation to be part of this panel, which connects the ecosystem to patients at home. This is a very important topic for us at B. Braun. I am responsible for the ambulatory care business at B. Braun, and that's what I do almost every day. I'm looking at how our tech initiatives, our initiatives in terms of processes and connectivity, how important they are to ensure the connection with the patient that is at home and needs a service and care. So I'd like to make a 10-minute introduction, speaking a bit about how B. Braun is doing within this ecosystem. B. Braun is a company that is 170 years old. We are a family-owned business, and we have been in Brazil for 55 years. And in these 55 years, we now have 3 plants in Brazil, EdTech, TID Medical, and Ed Pharma, bringing a lot of German technology to our country and ensuring that patients have access to hospitals, to health professionals and patients. This is really important in this ecosystem to ensure that this happens. B. Braun today can deliver 17 different therapies in the hospital and extra hospital. This is infusion, nutrition, anesthetics, dialysis services, and treatments for infections. Many things we can now support health professionals and mostly patients looking from a perspective, thinking of what we search for in terms of providing access to patients who are at home, not just in home care services, but chronic patients, patients who are at home and need outpatient care. So patients with diabetes or high blood pressure. And Brazil has an aging population that is growing and that needs care in their everyday lives. So today we are bringing to Brazil some important initiatives, not just in terms of technology, to ensure that these patients, even when they are at home, they have access to the level of service and care that they receive in a hospital, but also programs, different programs. So B. Braun currently has the Celebrate program, Programa Celebrar in Portuguese. We help patients when they are discharged from the hospital, and we provide a lot of information about how their life is going to be outside of the hospital when they go home with a home care support, or how can they continue their therapy and their healthcare throughout their lives. In this program, we work together with hospitals when the patient is discharged, because this is a very important moment in patients' lives when they leave the hospital, both for the patient, for caregivers, family members. They need to be sure that the treatment, the therapy, is going to continue in an appropriate manner. And the Celebratory program brings this care for these patients, whether they have been hospitalized or whether they have specific nutritional needs. I am responsible for the outpatient unit at B. Braun, and I have been working with some very relevant topics so that we can increasingly decrease the gap between the care we provide in a hospital and the care we can provide at the patient's home. Of course, we face some dilemmas when we do that. Transfusion systems or infusion systems, dialysis services for the home environment. And we still face some dilemmas in the market, some barriers, whether they are cultural, technologic, or even in terms of confidence, so that we can bring these technologies and implement them effectively, both for patients and also for health professionals to feel safe, and the hospital that is discharging the patient so that they feel safe, that there will be a continuity in the care for this patient at home. Looking at this difference that we currently have regarding the hospital and the home environment, we do have some specific discussion points that we are going to cover in this panel. It is a fact that the patient at home has considerable decrease in their costs. The costs are lower than at a hospital environment. And of course, if we use technology, connectivity, and other things that are very important for us to continue this journey. And we have to test these services in the home environment. So the main focus is the well-being of the patient. They need to have a safe environment. They need to trust the care that they will receive at home. Of course, we have to look at costs and who will be paying for these home services. And we have to look at the efficacy of these services that are provided at home. I wanted to give you the floor back, Bruno, so we continue with the panel. But that's a bit of how we look at caring for our patients at home here at B. Braun. And B. Braun is a technology company. Yes, B. Braun is an excellent partner. The interpretation booth apologizes. We are having audio problems with Dr. Bruno's connection. Well, Bruno, my apologies. We cannot hear you very well. I believe you gave me the floor. And first of all, I wanted to thank for the opportunity of being here. I wanted to thank Rodrigo and the whole FIS team who can be part of this panel. I wanted to take this opportunity to briefly tell you a bit about my story, our story here at my company, and how we can bring technology and processes to the home care environment. I have been working at the health area for 18 years. I've worked at Bardi and JJ. I've worked at GE, and I've spent some time at Sodexo as well. About 5 months ago, I joined Pixel. Pixel is a health tech company. Actually, we've consolidated different health tech companies. We have a track record of 18 years. We are a little bit younger than B. Braun. Anyway, we were created when Intel Capital, an investment fund, merged two different companies, Medical Systems and Pixel. These companies had a focus in radiology. So that they had PACS, which is the image part. They manage image services, and RIS, which is a system that manages imaging clinics. We also had Riverwood Capital, which is another investment fund, a US investment fund. And that allowed the company to acquire other companies to enter the lab market through a lease system. We have HES system as well, which is hospital management services, and some other small companies that joined the group. So the idea is to really be part of the whole health system, and that's how we can follow up on the patient's journey and make it easier. That leads us to the moment where we are right now. How can we lead technologies that today we have inside hospitals to make it possible that more people can be served at home? First, because this decreases the cost for the system as a whole. And as you know, these costs are increasing year on year. So this also improves the quality of life of patients. It fosters the use of technologies. Diseases that did not have a cure now do have a cure or can be managed. But that all comes at a price. And then we need to find a balance so that the benefit brought about by technology can be accessible to the population and not just to a minority. And that's when we see reduction in efficiency levels. Home care is an important tool for that. First, because if I am sick, I'd rather be at home if possible. If I can be treated and cared for at home with the same level of safety that I have in a hospital, I would rather do that. And I believe that most of the population would rather have a care at home as well. Also, how can I take all the technology and all the equipment that we have in a hospital to people's homes? And one of the major challenges that we face is connected to something that Erik mentioned: cultural barriers, and oftentimes some technology barriers as well. Many of the systems we have today were created to be used in hospital settings, and they're very complex. So oftentimes, when you have the patient at home, you don't have appropriate equipment. If you want to have a cutting edge iPad or a cutting edge computer in the hands of each health professional and different nursing professionals or caregivers, it would not be feasible. So oftentimes, even the network connection that you have is not enough to use the equipment. And at the end of the day, that hinders the use of programs that demand a good internet connection. So the challenge that we have is, how do we take the patient's journey? How do we transfer it to the home environment with a technology that is accessible to this population? That's what we're working on at Pixar. We are already in hospitals and in clinics and in imaging centers and labs, and we know how these systems work. So we have an interesting part of the journey covered already. We can connect, for instance, electronic medical records to the patient's home, but how can we do that in a way people can use it? So we are working on this right now. We have an AI tool that's called Louis, which allows us to connect electronic medical records and other exams and tests to tools that are easier to use, such as WhatsApp. So one of the ideas that we've been exploring is how we, how can these people entry this digital journey in a more accessible manner? We are developing an electronic medical record that can be updated through WhatsApp, or a medical test that can be delivered through WhatsApp. Today, 100% of the Brazilian population probably knows how to use WhatsApp. My grandmother, who is 95 years of age and is in a home care institution, she uses WhatsApp. So this is a way to make these services more accessible to nurses, to family members who oftentimes are part of the process. And also, how can we connect all these amazing equipment? You know, we have wristwatches that can measure body temperature, oxygen levels, heartbeats, blood pressure, and also emergency ventilators, for instance. How can they communicate in a better manner with cell phones or other equipment so that this information does not have to be typed? And we see this as a journey. It's going to begin in a more simple way, and the complexity will increase, the functionality will increase through time. You probably remember a while ago, you needed physical air tickets. You needed to take paper to the check-in counter if you wanted to travel. And today, if you don't have luggage to check in, you can just check in with your cell phone, and it's almost a contactless process until you get inside the aircraft. You just have to show the QR code and you can board a plane. And that's what we believe also for the health system. We are developing processes that help health professionals and family members so that they can be able to use these tools in a more efficient manner.
Sorry, Bruno, we are not able to understand what you say. We can't hear you. I'm sorry. I'm sorry. We apologize. The translation booth apologizes. He's breaking up. Like WhatsApp. So that are able to integrate the entire ecosystem. And that's what we're talking about, not only in terms of our multidisciplinary team, but also our partners such as Braun. So now let's talk about electronic medical records for home care patients. We apologize, Mr. Bruno's audio is breaking up. I think your question was about having an electronic medical record focusing on home care, right, Bruno? Yes, that's right. Well, we already have electronic medical records for clinics and hospitals, and we've been developing an electronic medical record that connects all of the other medical records, and that can be used in a home care setting. The medical care tool itself is very flexible. And of course, it tends to become stronger the more partners you have working on it. And that's interesting in the health sector. There are several companies that set out to solve specific problems. For instance, there are companies currently that are highly focused on providing drug-related solutions, defining which drug can be given at which dosage and so forth. So ideally, there should be a communication between the medical records and that type of tool. There are tools for monitoring and tools that are pre-programmed to follow the blood pressure of the patient and the ECG of the patient. It can tell whether there'll be a problem or not. So it's about connecting these tools. And one thing that we've been focusing on is how to implement these medical records in a simpler manner so that it's easier to access. And at the same time, that it provides safety and security when it comes to data confidentiality and to access by suspect individuals or hackers. So it's all about reaching this balance between these situations. When you're at a hospital or at a clinic, of course, you're in a controlled environment, you know what you're accessing. But if you go to a home care setting, that is no longer a controlled environment. So that's a challenge that we've been facing. And of course, we have to reach a balance in terms of how much protection we want to add and how easy we want to make that system in terms of access by the patient and in terms of patient safety. Bruno, picking up on what you said, I'm sorry, Bruno, picking up on what you said, we were talking about technology, but we have enough connectivity nowadays to feed into these electronic medical records. So in theory, no one has to touch those devices. There's an infusion pump, which is the space pump that's fully connected to electronic medical records. Once you prescribe a specific protocol or specific medication, this pump will then establish a connection with an electronic record, and somebody can have remote access to those data. And the same thing applies to dialysis machines that also transmit the entire dialysis session, any type of incident or any type of medication change. So these protocols are already in place. And we talked about that. The technology is there, but the biggest challenge is cultural and structural in nature. And I think we have to tread a path towards that with the therapies that we can apply at home. We have a limited number of therapies, but actually there are countless possibilities, such as dialysis at home, for instance, parenteral nutrition at home. And I think we have to cover these steps before we get there in the future. Yes, I think that home care has to go through that iPhone moment, as it were. If you remember, back at the time, the technologies used by the iPhone were technologies that already existed in the market. The other smartphones already had them, but no company had been able to use them intuitively and set them up in a way that was easy to use. I think we're reaching that point. And I think that one thing that will really help us out is 5G, in that it gives us the capacity to establish better connections and transfer more data. And also the speed is much greater. So 5G will allow us to expedite that process. But certainly these tools must be easier to adopt. Otherwise, the adoption is going to be easier. It's going to be slower. Yes, and I think that there'll be a positive impact on cost effectiveness, making the process more accessible to the paying sources, because that is also a challenge right now. Yeah. Right? We have to prove to the paying sources that it's easier and cheaper and more effective to do that at home in a manner that is intuitive and efficient. Yes, and you can also create great benefits when the patient's at home. Well, that's a totally different thing in terms of patient comfort and the cognitive aspects, because patients are in a setting that they're familiar with, and that helps with the recovery and also in maintaining the cognitive functions of patients. And I can tell that based on my grandmother, when she was in a hospital, she got much worse, but when she came back home, that was a huge improvement for her. So the more we can provide people with well-being together with clinical care, the better. Well, when it comes to costs, Eric, that's a constant fight, right? That we have with operators. And we've been trying to implement new programs and bring them into home care, such as the shorter hospitalizations for specific treatments, whether it is with antibiotics or stomach therapy or simply for physical therapy. And the hospitalization should have a beginning and an end that's pre-scheduled, and so that within that time frame, we're able to show our customers, which are the operators, show them how important it is to provide our patients with home care. I think that that's something that is very clear to families already. Bringing patients home, as one of our founders used to say, it's not about adding years to your life, but rather it's about adding life to your years. If you take the patient home, you can avoid infections, cross infections that usually happen at hospitals, especially because patients are weaker. And undoubtedly, the at-home treatment is much better in that regard. I think Erik had talked about a problem called Celebrar, which focuses on home care patients, right? Would you like to elaborate on that, please? Sure. The Celebrar program is a free of charge program that supports hospitals and institutions in the hospital discharge for patients with wounds or problems in the urinary tract. So as patients get discharged with a new chronic condition, we have a highly specialized nursing team. And when they get discharged, then they are referred to a rehabilitation center or elsewhere if they have to deal with the colostomy or live with the wound, and in terms of nutritional support as well. And with that program, what we see is that patients will often leave the hospital. And as I said in the beginning of my speech, it's extremely important and complex to have the patient go through the moment of hospital discharge and make sure that they'll have enough guidance, information about their new condition if they're a chronic patients. This is what this program is for. We help them and we refer these patients so they have a better quality of life when they go back home, whether they're staying in home care or if they're resuming their normal lives. There is a toll-free number. You can call B. Braun and request that program for your hospital. Well, that sounds great. I think that has a great connection with our service, and I have no doubts that B. Braun will certainly be instrumental in helping us providers in this home care setting. Felipe, you also talked about how easy, quote unquote, it is to maintain an information, a data system inside a hospital with everyone at the same address. And we in Pernambuco, we have approximately 500 patients at home, each one with their own reality at home. And we see high-class patients and low-income patients. So sometimes they don't even have access to basic conditions. So how is, I guess my question is, apart from WhatsApp as a tool to provide guidelines in terms of treatments and the clinical conditions of patients, and apart from that, does Pixel consider working with the management of home care and something from an administrative perspective or related to the business itself? Well, Bruno, it's a market that we've been assessing, and it's a growing market. We think that we could add value to it. This is still under study. This is a tool that is still being assessed and being studied to define if it will get good support. So where we see that we can add more value to our companies, that first, by being able to use AI to help us in the decision-making process. That's already been used at labs for more critical programs, sending them to more specialized physicians and not so critical exams, and sending them to less specialized physicians. The more we digitalize that data, with digital prescriptions and data, patient data, exams, I think this intelligence, the artificial intelligence, will become more and more helpful in helping us make our decisions. And we are more or less in the process of implementing protocols to help us make our decisions. Another very interesting thing is that when you collect this data from the internet, if you have to switch from one healthcare practitioner to another, that it becomes more fluid. If you have different shifts with different nurses or different physicians, if the data is digital, that can be done over the internet with online tools instead of them having to physically go there. You can also start making decisions as to whether it makes sense to discharge the patient or put them in home care. So you can also define the type of care that it can provide. So I think that these tools can be useful in that regard. Another aspect that was also mentioned by Erik concerns providing data where you can prove that that is the best or most effective treatment you can provide. Hospitals work with lots of data and graphs that help them make decisions. And I think that home care still has a lot to do in that regard, especially because most data is not yet digital. Yes, even though it's a service that's been used for over 30 years, the difficulties imposed by the fact that each patient stays at home, this is a difficulty in and of itself, and prevents us from better integrating the entire ecosystem. Thank you, Erik. Thank you, Felipe. It was a huge pleasure to be with you. We're closing our session, and I'd like to thank everybody from FIS Initiative, Rodrigo, and others. And I am sure that this project will continue to grow. Thank you, and have a great day. Thank you. Thank you, Rodrigo. Thanks, everyone.